So what is this sign? So what do you see on the X-ray? Okay, I'll give you a hint. This is congenital heart disease. Bootleg syndrome. What do you see? So you notice this. So this is more of a upturned cardiac apex, right? So you notice right ventricular hypertrophy. It's not always present, but in majority of the patients, like up to two-thirds of the patients with TOF will be having this. So the narrow upper part of the boot results from a small or absent main pulmonary artery, partly caused by a narrow infundibulum and hypoplastic main pulmonary artery. Okay, so let's try to give you refresh the whatever we all have learned. So if you all can recall, the normal pulmonary vasculature is this is how it looks like. Okay, so there's an orderly tapering and branching towards the periphery, and the vessels become invisible, and the subpleural lesions of the lungs, in fact. Okay, and then the lower lung zone vessels are greater in size and number as compared to the upper zone vessels. So what it looks like. So to be able to describe what is abnormal, we should be able to know normal first. So that is what is very, very important. As I had already said, it is yes, it can be seen normally in pulmonary stenosis, aortic stenosis, even left to right shunts as well. You will be able to see those lung vessels. So that is why to be able to identify the pulmonary lung vasculature is very important. In the sense, as I said it, you should be able to only when you know what is normal, one will be able to tell, okay, this is good, this is not good, right? So what is happening over here? So what is happening in this field? So as you can already see, the individual vessels are dilated and also tortuous, which is extending into the periphery. So this is characteristic of increased pulmonary blood flow. Yeah. So the increased pulmonary blood flow is happening over here. If you want to see more, I'll show you more. Increased pulmonary blood flow. So what is happening is, in such cases, for example, in this one, this is a special one. The diameter of the RDA means, I mean, right descending pulmonary artery is bigger than the diameter of the trachea. So always use them as references. For example, yeah, if you will be able to notice the trachea size here and the right descending pulmonary artery. Of course, the RDPA is bigger than this. So similarly, what is happening over here? So there are some these concave main pulmonary artery. It's happening in conditions as if there is hypoplastic pulmonary artery, if the absent pulmonary artery is there, otherwise also abnormally placed pulmonary arteries. And then comes the dilated main pulmonary artery. So it is due to the post-stenotic dilatation or increased pulmonary blood flow. Also in cases of increased pressure in the pulmonary artery, of course, as well. So after you have been able to see like this, so what is the step two? What is the second step? So you should analyze the main pulmonary artery. So is it normal in size, dilated or concave? So which you already had a look as well. So after this, as I said it, pulmonary vascular pattern is very important in determining the initial treatment. Why is it? Because if uh, if it is normal, if there is a congenital associated congenital heart disease on echo, there's no immediate palliation is needed. However, if there's increased blood flow, shunt closure, or of course artery banding may be needed. However, if there's decreased blood flow, then flow augmentation with shunt should be done. And if there's pulmonary venous congestion, then you should correct the left sided obstructive lesion or heart failure, in fact. Then comes the pulmonary venous congestion. So it is a common thing, a lot of times, especially in the emergency, a patient is going to come with pulmonary venous congestion. So where do you see? We already showed you some of the examples, like the mitral valve disease, cotriatum, cotriatriatum. So this is more of a tongue twister word, huh? And the TAPVR with obstruction, otherwise also the hypoplastic left heart syndrome as well, you can see. So how does the X-ray look like? We are talking about radiology, right? So let's try to see some examples. So if you look carefully, so this is what is characteristic of the alveolar edema. So huge pulmonary venous congestion, bad lung. So one should be really taking immediate care of this. So when it comes to interstitial edema, especially over here, around here, you can really have a look. Yeah. Examples is something which is really important, as I'm telling you. And then comes the redistribution of the. So with passage of time, yes, it can be redistributing as well. So pulmonary congestion can also happen. So similarly, decreased pulmonary blood flow can also happen. But what are the conditions for that? It happens in TOF, critical pulmonary stenosis, tricuspid valve atresia, and even pulmonary valve atresia as well. So what are the what are those areas, as I was telling you? So so if you look carefully, so pulmonary over here, this is the normal one. So for example, you will see whitishness which is there present everywhere over here and all. However, if you look only in this region, it is more of a whitish. Otherwise, in other areas, it is pretty dark. So this is what is meaning of decreased pulmonary blood flow. Then again in this area. So this is what is characteristically called as hyperlucent lungs, in which you see thin, stringy pulmonary vessels. And you are already smart enough, so you already know the conditions as well. So even in this as well, you see there's more of a hyperlucent lungs, thin, stringy pulmonary vessels. So now coming to the increased pulmonary blood flow, it can happen in two conditions. Either it can be cyanotic, otherwise it can be non-cyanotic. Cyanotic can be in terms of the transposition of great arteries, patent truncus arteriosus, or even TAPVC, or in conditions like single ventricle. So there can be non-cyanotic conditions as well, which is associated with um, increased pulmonary blood flow, like the VSD, ASD, PDA, or uh, PAPVCs as well. So why I was telling you, so for example, this is how is the normal one. So there is good exposure, which we can see in this lateral film. Okay, but what happens is over here, this is more whitish, right? There's those blood vessels, they seem to be more whitish. So this is what is more characteristic of the increased pulmonary blood flow, in fact. And the diameter of the pulmonary artery is, of course, bigger than the accompanying